Assalamu alaikum wa rahmatullah. Good evening, everyone. Thank you for joining the session today. Most of us are familiar with today's presenter, as many of us have witnessed him as a speaker during our Cohort 1. But who have joined us recently, let me introduce you with Dr. Shahjahan Shah. He is currently working as a senior pharmacist in King Abdulaziz Medical City, Jeddah, Saudi Arabia. He has done MPharm and he is certified professional in healthcare quality. Mashallah, he have extensive background in the field of pharmacy and quality. It is really fortunate for us to learn from him today and also to learn from his lecture and experience. We really appreciate him for his time and effort in directly teaching us today about the performance improvement tools. Well, thank you, Dr. Shahjahan, for joining us today. You can start.
Bismillahirrahmanirrahim. Assalamu alaikum all of you. Thank you so much to join this lecture. So today, as you know already, that we will discuss about the performance improvement tools. So we will start with this disclosure. I have not received any financial or commercial funding or support for today's session. No commercial trade names are used in today's presentation, and I don't have promote any specific brand. So we will start with the performance management. Performance management is an approach used to manage performance of an organization. It can play an important role in the success or failure of a business. It can be applied to measure the performance of an organization, a business unit, a single department, a project, an employee, and even the process to build a product or service. For performance improvement, we are using different tools for the planning, for the decision making, for the data collection, for the data analysis, and for the root cause analysis. So we will just discuss all this one by one. These all tools that why we are using, what is the importance of that tool, and regarding the exam, what things they are asking, what is the important thing for that tools. So we will start with the tools for displaying of the data. So displaying the data, we will start with the pie chart and the bar chart. These charts we are using for the nominal and ordinal data. And displaying of the numerical data, we are using the frequency table, histogram, frequency polygon, box plot, scatter diagram, and line graph. So now we will go further to discuss each one by one. So first of all, pie chart. This is very common chart which we are using in our life whenever we are giving presentation. So this chart, when we are choosing this chart, when we want display relative frequency percentages of proportional relationship with a group, usually used to display parts of whole percentage. Like we have any data we want to divide and we want to show that we want to show the percentages or the groups or the parts of that data. Like example, we have surgical site infection in different departments. As you can see in this graph, surgical site infection, we are displaying the data for the general surgery, urology, ortho, and gynae. So is this type of data, which is nominal data, we can show or display by this one pie chart. The other graph which we are using to display the data is bar chart. This is also very common chart which we are using in our daily life. Display of comparison between different groups, two or more categorical variables. Each bar represent a category. So you can see in this one that when we have different groups and we want to show, that time we will use the bar graph. Like see, we have here example of the average hand disinfectant use department and work group wise distribution. So this is the doctors of different groups. Like is blue bar is for the medicine doctors, and this orange bar is for the surgery doctors, and this gray bar is for the dental doctors. So we have one category of doctors, one is nurses, one technicians, one ward assistants. So we want to just display our data that how they are doing the disinfectant. So it's very easy to do by display by this bar graph. So you can easily judge that what's going on in the data. You can see that ward assistants data is very less here, 1.83 only. And mostly if you see the doctors, surgery doctors, they are using the more hand disinfectant. So by this graph, it is very easy to visualize the results of your data. The other display data is this is for the frequency table. This is we are using for the continuous data. So this example, if you see that this is an example of frequency distribution of injury type at a workplace. Like in one workplace, how many injuries happen in the whole year or whole 2 years. So how we can make and display that by the frequency table, we can say that total we have 47 and fall was 14 and cut was 8, burn was 3, back injury 2. So like this. So this is just an example of the frequency table. Then we are using a histogram for the data display. Histogram is a special type of bar chart used to display the variation in continuous data. The histogram illustrates the shape or distribution of the data by indicating how often different values appear. High bar indicate mean, median, mode. This is the high bar. This is the mean or median or mode depend upon the values. No space between the bars, as you can see here, there's no space between bars. Accumulate at least 5 bars. At least we should have 5 different data so that we can accumulate 5 bars. Used to show whether data are symmetric or skewed. This one we are using to show the data is symmetric means it is balanced. Skewed means it will go one side. It is very high here, but very low here, so it will be skewed at this side. But if it's symmetric, it is balanced. Like in this data is almost symmetric. This example is for the pharmacy drug dispensing turnaround times. That pharmacy is dispensing medication and how many times it's reached to the ward. So if you can see here, in this graph, we 0 to 10 minutes, from 0 to 10 minutes, one medication reach, 11 to 20 minutes, two medication reach, 21 to 30 minutes, around 3 medication reach. So the mean, what is the mean? The mean is that 41 to 50 minutes, 6 medication reach. So it means mostly medication average or mean is mostly medication after the preparation reached the ward in the 50 minutes. So by this one, we can judge our data and we can check our data. So it's very good graph to display the continuous data. So you can observe that what's going on, why it is more high graph, why it is going to less, why the data is skewed to one side. So this is very important. Then there's a box plot. A box and whisker plot is defined as a graphical method of displaying variation in set of data. A histogram analysis provides a sufficient display, but a box and whisker plot can provide additional detail while allowing multiple set of data to be displayed in the same graph. So this is almost same like the histogram, but when we have many groups and we want to show their data, then we are using the box plot, also known as whisker plot. Box and whisker plot allow for comparison of data from different categories for easier, more effective decision making. Use box plot instead of histogram when you are comparing several set of data. Sometimes it is very difficult to understand the box plot, so I make one small example so that you can understand this, how to interpret this box plot. Now you can see here, this is in this box plot, this is known as upper extreme. So I will just start from the lower extreme, the smallest value in the given data. What you have the data set, what is the smallest value, it will come here and the lowest extreme. And then the highest value in the given data set, it will come here in the upper extreme. So this is the two, high and low. Then there's a median value, the middle number in the set. So this is the median value. Here we will show the median value. And then this is the lower quartile lower quartile, below that value, the lower 25% of the data are contained. And then there's the upper quartile. The lower quartile is this one. This means that the values below this one is 25%. And upper quartile means the values are upper to the 25% of data content. And whisker, the line that extend from the boxes, they are used to indicate variability outcome of the upper and lower quartiles. So this is the whisker line. This is the median. This is the upper quartile. This is the lower quartile. This is upper extreme. Now I will show you an example, very small example, an easy example for that you can understand this how we are making this box graph. Now, for example, suppose you have the math test result for a class of 15 students. Here are the results. So this is the result. This is 15 results. Someone take 54, 66, 69. This is the result. So we will just make it ascending data. I make already this one from lower to higher. So this is total 15. So what is the median of this one? Median will be the 80. So 80 is the median value of this one. And then we will divide the left half and the right half again in the half. So here will be lower quartile at the 70, and 54 is the lower extreme. And the right side, if you will come here, this is the upper quartile, 88, and 95 is the upper extreme. So now, after first of all, we should have the data set which we receive from the result of the math student. After that, we will give the values that which is the median, what is upper quartile, what is lower quartile, what is lower extreme, and what is upper extreme. Then we will make the box graph. Now you can see here the box graph. And this one we make a normal scale from 50 to 95. This is the scale. Now we will make this box plot. You can see what was our upper extreme. Upper extreme is here 95. So this line is 95. So it means the one student who take the highest number is the 95 numbers. So you can easily judge from the graph. And you can see what was the median. Median was the student who took the 80%, 80 marks. So it will come here. This is the median line, 80. And then there is a lower quartile. This is the line of lower quartile, which is the 70, lower quartile. And the student who took very less number, which was the 54, it is the lower extreme. So lower extreme line is here. So now you can easily, whenever you have a box graph, you can judge that this line means lower extreme, and this line is the upper extreme, and this is the median 80, and this line is the upper quartile, and this line is the lower quartile. So the box and the whisker plot show that 50% of the students have a score between 70 and 88 points. So now we are going to analyze this box graph. So you can see that this is the 50% data in this box. So 50% of students taking from 70 to 88 numbers. In addition, we can more analyze 75% score lower than the 88 points. You can see here from this point 88 less than all, from this 88 less than all the students who take the score less than 88 points. And 50% have test result above 18. And 50% students take the result more than 80. If you have test results somewhere in the lower whisker, you may need to study more. So if there's lower here whisker, so you have to discuss why they are taking the less numbers. It was the simplest box and whisker plot example just to illustrate what the plot shows. So I hope you can understand this. So whenever you have sometime some research studies, they show 5 or 6 graph in one display. So you can just compare this graph by this scale, down scale, that where is our study going. You just should know that this line does what does mean, what is the meaning of this line, and what is the meaning of this line. Now we will go on another graph, which is known as the scatter diagram. Scatter diagram also we are using to study possible relationship between two variables. We want to check there is a relationship between two variables or no. This is just one example that this is the average wait time to see doctors of emergency department. that how much time patient is taking to reach the patient. This is a normal graph. And here, this 4 graphs I show you. By this graphs, we can see that which we are discussing, that in the variables there's any relationship or no. So we divide this relationship in the strong positive relationship, a strong negative relationship, a strong weak relationship, or weak negative relationship. So for example, we are attending a meeting and we are discussing that the number of falls are increasing because we have more vacancies of nurses. More vacancies of nurses means we have shortage of staff of the nurses. So we discuss in the meeting. Now we show this graph to our director. That fall of patient are falling on the floor because there's no nurse to teach him or guide him or counsel him what medication take at what time, when he can go down the bed. So we want to show our data. The data which we are showing, there's a positive relationship means you are correct. If negative relationship means you are wrong. So here in this graph, where is strong positive relationship, we want to say in the meeting that due to the less nurses, when we have less nurses, we have vacancies of nurses more. Patients are falling more. So as you see in this graph now, as the increasing the nurse vacancies, also falls are increasing. So whenever we have shortage of nurses, there is fall data is increasing. So it means what we are saying is correct. There is a strong positive relationship between these two variables. And then in the meeting, they can accept, yes, your data is statistically correct, that this fall is due to the nursing issue. Now come to the second figure here, a strong negative relationship. Same thing we want to show, but the data which we have, which we collect the data, is showing here that is the vacancies of nurses increasing, the fall is decreasing. So it means fall is decreasing and nurses vacancies are increasing, means due to even more shortage of nurses, falls are decreasing. So it means there is any other reason, not the reason is the nurse, there's another reason. So here in this graph, this is a strong negative relationship. Now same thing come to this graph, weak positive relationship. When there's a weak positive relationship, the dots will be very far apart from the median line. So this is weak positive relationship. Here in this figure, you can see weak negative relationship. Also here, same graph, but the dots are very far away from the median line. So this is the weak negative relationship. I hope that you got this one. If you have any question, you can ask me later. Then the frequency polygon.
Can you repeat strong and weak?
Yes,
The difference between strong and weak relationship. Kindly explain again.
Yeah, the difference is that, as you told you, that in the meeting we want to inform our management that the patient fall number increase, because sometimes patient fall from the bed or when he is walking or when he is washroom, because he don't have the guidance from the nurses. So we want to say our director that we have shortage of nurses, that's why falls are increasing. So we want to show this data by statistically. So if you see in the strong positive relationship, is the vacancies of nursing are increasing here. Here, these dots are increasing. As the vacancies of nurses increasing, means we have shortage of nurses. With this data, also falls are increasing. So it means in this graph, I am correct that when I'm saying that as the vacancies of nurses increasing, the fall data is increasing. So this means there is we have two variables. One is nurse and other variable is the fall. So here we will see, yes, when nursing vacancies are more, it means that the shortage of nurses, and we have fall values are more. So it means there's a positive relationship between these two variables, that we are saying correct data. So this is the strong positive relationship. But in the same scenario, we are representing this graph. When we are representing this graph, in this line you can see, is the number of vacancies increasing, the falls are decreasing. Here is the fall where I'm putting the cursor. So vacancies are increasing and the falls are decreasing. It means now our data is not showing the relationship between the two variables. We are not correct here. There's any other reason of the fall. So here, this is a strong negative relationship between the two variables. Is it okay? Now it's okay.
Yes, it's okay. You can proceed, Dr. Shahjahan.
Thank you. The other graph, we are using the frequency polygon. The frequency polygon can serve as alternative to the histogram, but histogram, we are using the bars. Here, we are just using the one line to show our data. The other graph we are using is the display the data is line graph. Like we will just show by the line. There's an example like we want to show our growth of one brain. In the 2002, it was 24%, and then 2003, 54, and 2004, it is 215% increase. So by this one, we can just easily display the data, and easily we can understand that what's going on in our industry. So this is known as line graph. Now we are going to discuss another tool, which is the data collection tools. That when we want to take our data, which tools we have to use. So we are using two main tools, key performance indicators and check sheets, by which we are collecting the data. So first of all, key performance indicator. Indicators are quantitative measure of a specific part of process. Successful quality indicators should be valid and reliable. Indicators are used when a team needs baseline data about how process is performing and detailed data. Demonstrate the effect of particular improvement. Department KPI must be selected based on the importance in case of services. And KPI, there are three types of KPI: structure, process, and outcome. This is very important in the exam because they are giving some examples of data, and then they are asking that this indicator is which type. Indicators means, for example, I will give you the example in the pharmacy. We are using the one indicator, that availability of the medication. That we have doctor prescribe one medication, it is available or no. So we are checking whole month this data, that this medication prescribed, it was not available or available. So this type of indicator is known as the structure indicator, that medication available or no. And the other one indicator again. Excuse me, there's any question?
No, Dr. Shahjahan.
Okay.
You can proceed.
So,
sorry for the inconvenience.
Okay, I was discussing about the key performance indicators, that why we are doing the performance indicators, because we want to know the our data is going to be incorrect on the path or no. So for example, I give you the example of what is the structure indicator. Structure indicator means we have the available any equipment or any service available or not available, like medication available, this is the structure. But if sometime we are doing another indicator also, that prophylactic antibiotics are given to the patient on time, or the correct antibiotic which is recommended for that surgery is given or no. Like, so that indicator we can say that this is process indicator. For the outcome, we can for the outcome example is that if we are like we can say that we have medication errors. We dispense the medication already to the patient, but it is giving the wrong, and patient took already. So this is the outcome of the dispensing of medication. So this is the three types of indicator. Now there's another example I will give you, which is easy. That structure, like we have imaging equipment in our hospital, like any machine which we are using for the imaging, ultrasound machine or any other machine. So that machine is under the structure perform indicator. When we are using that machine to diagnose a patient, this means this is a process of that machine. So this indicator will come under the process indicator. And when we will see that how many patients early diagnosed due to their technology, this will be the outcome of this indicator. So I hope that this is clear for the indicators classification. Like in this picture, you can see when there's one patient coming, he will use insurance, transportation, wait time, delays. So now the hospital structure is the structure indicator. If anything we will use from the hospital like health system, facilities, equipment, credential, this all will come under the structure indicator. And we are doing any process like test, treatment, procedure, this is come as the procedure. After doing all these things, what is the result? That will be known as the outcome of the indicator. The other tool for the data collection is the check sheets. This is simple check sheet which we are making for the on the Excel sheet. Like in the pharmacy, we want to check the some highlight medication or some very expensive medication available or no. So we will check every day. We are checking the temperature of the fridge is correct or no. We are checking the temperature of the IV room. So this all are the check sheets. Also for the indicators when we are writing our data in the Excel sheet, that is also the collection check sheet. The check sheet is simple document that is used to collect data, typically a blank sheet which is easy to record qualitative or quantitative data. Steps of check sheet to use: agree on the data to be collect, decide who will be collect the data, select a sample size, distribute the sheet and collect data. Then after collection, evaluate the data. And types of check sheet classification is location, frequency, measurement, or checklist. There are types of sheet. Now, after the data collection, we have another tools which we are using, the planning. Whenever in our organization we are going to implement any project, that we are starting a new project, we are going to start oncology service, or we are starting a new hospital, and we are starting a new department. So which tools we will use at that time? So first of all, the tool which we are using for the planning is the Gaussian planning. The second tool is the Gantt chart. The third tool is the arrow diagram, and fourth tool is the task list. So when we have planning, we will use these tools. In the exam, you will also get the scenarios like this, that they will give you a graph, or they will give you a situation. Then they will ask you that this is what is this scenario? This is planning, or you want to do planning for this type of planning. Which tool you will use? You will use Gaussian, or you will use Gantt, or you will use arrow diagram. So when you understand the concept, you can analyze the scenario based question here. First of all, the Gaussian planning. Gaussian planning is defined as an ongoing effort undertaken by the organization as a whole throughout the process of continuous performance improvement to move toward its long-term goals. So see in this example, there is 7 steps of Gaussian planning. First of all, establish the vision and assess the current state. We will see what we want to do, what is our vision, and currently where we are. And after that, we will develop breakthrough objects. We will divide the things, how we will divide the goals and to whom we have to give. And then we will define that what is the annual objectives, that we start the hospital now, what is our next year, our goals to be accomplished. After that, fourth step, cascade goals through the organization, and then how we will implement these goals, and then execute annual objectives. After when we know that what's our goal, we will start to execute objectives, and after that we will monthly review, that we start the already our service oncology, it's going on well, what's the problem is coming, why there's problem, how to solve that one. So we will review monthly, and then at the end we will review annually, that whole year what was the issues and what was our goals, where we reach and what we need to do now. So this all the planning from the start to the end is the Gaussian planning. Then there is a other chart, Gantt chart. This is also for the planning. A Gantt chart is a type of bar chart that illustrates a project schedule. Gantt chart illustrates the start and finish date of the project element, the dependency relationship between activities, percent complete, and vertical line show today. So whenever we want any project, we have to show our management that when we will start this project, and who will do this project, which staff, and what is the date to accomplish, when we will start, when it will end. So if you can see in this example, that we have a project here for the research. So first of all, we will start planning. Let's say we will start planning from January to March. We will start planning. And during this tenure also, we will start the research for that project. And we will design from March to April. And then we will implement that project from April to start of the July. And then after this, we will follow up again this project at the end of July. So it means this is our guideline that it will start from the January, it will end in the July, and we have different things which we will do, like planning, we will do in which month, research in which month, design in which month, implementation in which month. So it will be easy for everyone. They know that where we are now, where we reach now, and who will do this, all the things. So this is the Gantt chart. The other graph is the arrow or activity network diagram. Arrow diagram, also known as activity network or critical path diagram. This is also very important. There are 2 or 3 terminologies sometimes for one tool. So you should remember this one, because in exam maybe they will ask activity network or they will ask critical path diagram. So you should know all these terminologies of one tool. In arrow diagram, nodes represent start and end, or arrow represents activities. The essential techniques for using critical path is to construct a model of the project that include the following: a list of all activities required to complete the project. Means we will make this is very simple, that we will start this from here, then we will do this activity, then we will do this activity. So different activities we will do, and we will connect that activities with the arrow. As you can see in this example, we will start with this one, then it will go here, then here and here. So we will make a node and the arrow to show our activities, how it will go on. Then the last is the task list, also known as planning grid or deployment chart. See, also for this one, there is 3 names: task list, planning grid, or deployment chart. Task list is the most familiar performance improvement tool used to schedule a project task. It has the following characteristic: keep the team organized and on the track, keep record for what has been done so that nothing will be overlooked, used to identify steps to be taken, timeline as responsibility of whom. So in this one task list, just we will, as I told you in the start Gantt chart, we have defined who will do the work in that task list, and who will be responsible, who will be the supervisor, who will be the data collector, who will be the recheck again that data. So we will define all the things in the task list. Now we are going to discuss about the decision making tools. When we want to do any decision, which tools we have to use. So for the decision, we are using the brainstorming, affinity diagram, nominal group technique, multivoting, Delphi method, selection grid, and spaghetti diagram. Brainstorming is a creative group process used to generate large volume of ideas in a minimum amount of time. Brainstorming required clear direction, active participation of all members of the team, and facilitated by the group leader. The importance of the brainstorming is stimulate creativity, ensure participation of all participants, strengthen the team, result in rich list. Excuse me, I'll just take water. So brainstorming is we are using the tool when we want to do anything. We won't decide anything, how to do that one. So we will just make a meeting and call all the staff. They will discuss that, for example, we have a problem in the hospital, why we have more medication errors happening. So everybody will give different views, that because there is shortage of staff, because that night shift we have less staff, because staff was sick, or because there's problem in we don't have the pharmacy aid. So different ideas will come. So this is known as the brainstorming. What is the basic rule in the brainstorming? Focus on quantity. The greater the number of ideas generated or generate the chance of producing a radical and effective solution. Money is no object in the brainstorming. So what we need in this one, we need more ideas from our team. Withhold criticism. Criticism of ideas generated should be put on hold. Instead, participant will feel free to generate unusual ideas. Welcome unusual ideas. They can be generated by looking from new perspective and suspending assumptions. These new ways of thinking may provide better solution. Combine and improve ideas. Good ideas may be combined to form a single better good idea. So in this one, the basic rule is that when we are receiving the ideas, we will not criticize that no, this idea is not good. Let them give different ideas. Then we will select that which is the good. So after that one, when we finish the uh, this one brainstorming, now what next tool we will use? We will use the affinity diagram. What is the affinity diagram? Affinity diagram help people to organize large number of ideas into meaningful groups on natural relationship. It is used at the start of project because they help to team to focus on major issues. The benefit of affinity diagram brings a recognizable shape to shapeless issues, simplify large or complex tasks into small projects, help to narrow the focus on sensible fashion. Steps of affinity diagram includes record each idea on cards or notes, look for ideas that seem to be related, sort cards into group until the card have been used. So in this one, because when we did the brainstorming for decision, we have maybe more than 30 ideas. Now this is very shapeless that, so we want to make them in a heading wise. Like in this example, we have the problem in the INR, taking of the INR patient. So we have different all these ideas we receive randomly from the staff. So what we will do, we will divide that idea. Like in education, there's no orientation for the medical this one JMO regarding INR, no medication reconciliation. So this is coming under education. Then communication, we will make under communication all these problem, no flag from lab, no medication reconciliation, no written handover. Then what is coming under the environment? INR machine was broken. What is the documentation problem? What is the policies problem? What is the monitoring problem? So which the ideas which we get from the brainstorming, all that ideas we now divide in each category so that we can easily understand what are the issues. Now the third tool for the decision making is the multi-voting. Multi-voting is diplomatic, non-threatening selection process used to narrow a broad list of ideas. Even though now, if you see here, we have many ideas. So multi-voting is diplomatic, non-threatening selection process used to narrow a broad list of ideas generated by brainstorming at any stage of performance improvement process, down to those that are most important for further attention. It can be repeated series of votes until the list is narrowed down to appropriate number of items to focus on. Furthermore, it can be used for prioritization. So multi-voting technique, just we will say from this idea which is more important, yes or no, yes or no. So we will narrow down more from the more numbers to the less numbers. There's another also technique. This is nominal group technique. It is a group decision making process for generating a large number of ideas with following characteristics. This is another way also generating ideas. Each member work alone. Here, each member will work alone. Used when members have different opinion and goals or they don't know each other. Most structured than brainstorming and multi-voting. More structured than brainstorming and multi-voting. So this technique have some advantage than the brainstorming because each staff will sit separately and they will write the ideas. There's another method for decision making is the Delphi method. This is very important. It's coming in the exam also. So what is the meaning of Delphi method? This technique is a combination of brainstorming, multi-voting, and nominal group techniques. So this is the technique of combination which we discussed already. The brainstorming, multi-voting, and nominal group technique. Delphi method utilized when group members are not in one location, and we are using email and then send it to one person who repeated narrowing steps anonymously until reaching the consensus. So and simply Delphi method is that when we have corporate hospitals, we have 5 hospitals. So we cannot do meeting of all the pharmacists in one place. So what we will do, we will send this all the consensus by email, and then they will reply that one. As you see in this picture, that if we have one scenario, pose broad problem to ask for answers and comments, and then all the staff will answer by email, answers and comments, then feedback, analysis and summary of A1. Then what we will do in the second round, pose modified problem by integrating the feedback to invite participant to re-evaluation or revision of the A1, and then A2 re-evaluation or revision of the confirmation of their A1, and then feedback. And then at the end, third round, repeat round until the reaching to the satisfying consensus. That all the brainstorming and multi-voting we will do by the email, that for this we want to decide this thing. So what to do, we will do this by email until we concise to a small our objects. The other thing is the selection grids, prioritization matrix. Now this is also very important tool which we will find in the exam questions. This tool is used items and describe them in terms of weight criteria. It uses matrix diagramming techniques to do a pairwise evaluation of items and to narrow down the available option to the most desired or most effective. Selection grid draw a team toward consensus in a logical and objective way that reassure team members of the validity of the decision-making process. One of the most important characteristics of prioritization matrix is easy and quick implement. Like before, we are just in the brainstorming or multi-voting, we are giving the vote, but that is not means logical way. This is a more logical way option to decide our options. For example, we want to buy equipment for the pharmacy, and now we have 4 equipment, and our team want to decide which equipment to buy. So by this prioritization matrix, we make a specific score for each criteria. Like we make cost effective criteria, score is 0.85, decrease defect, score is 0.8, increase productivity, score is 1.75, user friendly, score is 0.5. So now all the team members will give a score to that machine. Equipment number 1 receive this score, equipment number 2 receive this score, equipment number 3 receive this score. So like this example you will receive also in the exam. So what is the main thing to understand here? We will sum all this score at the end, and the equipment who have more score, this is on the rank 1. We have to select this equipment by the logical way. Why we will select this equipment? Because you can see cost effectiveness, there's 2 points, decreased effect, there's 3 points, increased productivity, there's 3 points, user friendly, there is 4 points. The total point is 11.75. So we will select this this machine. And there's another decision tool is spaghetti diagram, or the other name is layout diagram. Spaghetti diagram is graphical representation of flow or traffic or a movement used in the lean manufacturing activities. It is used to detail the actual physical flow and distance involved in a work process. A spaghetti diagram is used to demonstrate flow or movement in a process. It reduces employee fatigue and improve employee morale, to detect wasteful movement and identify ways to increase the speed of process. So by this, in an example, you can see there's 2 examples. For example, this is a pharmacy. From one pharmacy, we are giving the medication to the ICU. Now ICU is very far. So nurse will come, take the medication, will go to ICU. If we make the ICU near to the pharmacy in the start when we are making the hospital, because we know we need urgent medication. So this will be a good example of this one. So we will make that department near to the pharmacy, and then you will be easily reach the medication there. In this picture, you can see that this is the center here. One process is very complicated, going to this person here, also this person. So in the lean program, what we will see that how we can reduce the more movement, how we reduce the more people, how we'll reduce the more hours, Like if we use the pneumatic tube system, instead of sending the 1 hour pharmacy aide to get medication from the pharmacy and give to the nurses, it will take more pharmacy aide, it will take more time. So when we use the pneumatic tube, it will directly reach to the ward within 2 minutes. So this is a lean project, that you will first recognize the whole scenario, that how we can reduce the workload from the staff. So after this, you see in the first picture, there's more work, and the second picture they organize some things, and then there's a less work. So this is just the means the concept of the spaghetti diagram. Now we are going to discuss the data analysis tools, that what we are using for the data analysis. For the data analysis, we are using the line graph, control chart, run chart, interrelation diagram, force field analysis, and interrelationship diagram. Sorry, this is 2 times. The line graph, what is the line graph? Usually you are using this in your pharmacy, and you are using indicators, or sometime when you are showing the result of your project. Line graph is a chart that plot points on a graph to show level of performance over time. This is very important. The performance over time we have to show by the line graph. It is used to help team to understand the process, identify areas of improvement, and compare trends and pattern in the process over time. A line chart represents the data by connecting the data points by a straight line to highlight the trends in the data. Like in this example, you can see this is the data of 3 machines, that how the scrap products, which they are using for the scrap product. Means see in this machine, machine 3, the products which they are making very less scrap. This machine is good. So here, but if you see this machine number 2, this one, it's going more than 10,000 scrap products. So this is very easy tool to display your results. You can very easily diagnose that where is the problem. Now you know, okay, there's a problem in this machine too. So we have to further analyze this data, that what to do, for why there's problem coming in this machine. So this is the line graph, means performance over time. Now the other chart is the run chart. Run chart is a chart that graph data over time. Also, this is the data over time in relation to the central point. But here we will make a central point. Such charts are superior to narrative since it shows a trend over time. What is the benefit of the run chart? Identify trends and patterns in the process, like line graph. Identify how far we are from central point. When we make the central point, then we can know by statistically that how far we are from the median or the average, such as the mean or the median. Understand how a process is working and identify areas in need for improvement. Clarify if performance is static or changing, means changing for the better or it is going to worse. Wait, no, interpret the result until at least 10 or better 20 data points have been plotted. Means you have make this chart when at least you have more than 10 points, then you have to make this chart. So we will the run chart. How is run chart identify areas for the improvement? Now this is just some definition, then I will show you this example of the run chart. You can just see this is the median here. Here this is the median line. So I will just show you here what is the meaning of the shift. Shift is 6 or more consecutive data points, either all above or below the center line. So this is known as the shift. What is the trend? A trend is indicated by 5 or more consecutive data points all going up or down. They are going up or down. This is the trend. And what is the astronomical point? Astronomical point, a data point that is an obviously different value, 8 outlier. However, a normal maximum value of data set is not astronomical point. A shift, trend, or astronomical data points are all signals of non-random patterns and should be investigated to get a better understanding of the process under review. So see in this chart, now this is the run chart for the infection control. We are checking the infection rate in ward 6, that how is the infection. So you can see here, In the January, there was 10. In February, 16. Then March, it was 10. Then increase in the May. Then after May, the infection rate decreased down. See, 1, 2, 3, 4, 5, 6, 7. Around 7 or 6 point decrease down. So how we'll analyze this this graph? The main thing is the median, that this is the median where we should be. Now this is increasing here, means it means that there is some problem why it is increasing. Now here it is going to decrease. It means we did any intervention at this point. We do any project that what was the problem, and we solve that problem. After solving the problem, now the line is going down here. So this line is showing that system changed onward, and it was very effective. So the infection control rate was going down. Now I will show you the how you will analyze that shift, how you will analyze the trend. Now if you have this example of the run chart, now see here in the observation 1 is the point 10. Then here from this one is this the 1, 2, 3, 4, 5, 6, 7 points. This is the example of shift. As I show you, tell you before, that if there is any points on the center line, 6 or more point, that is known as shift. But if we have any points which is going up more than 5 or more than 5 point going down to the center line, that are known as trend. And any value which is very far away from the center line, here, like you can see, this is the astronomical data. It means there are some problem here. This is not normal in our data. So here, this is the shift, and this is the astronomical value, and this is the trend if going up or going down. Now the next chart is the control chart, also known as Shewhart chart. So these two names are also very important. Sometime in the question they are asking control chart, sometimes they are asking the Shewhart chart. Also control chart, Shewhart chart, or process behavior chart. Control chart is like run chart, same like run chart as you see before, but it includes statistically determined control limits on each side of the central line. Here we put the values. These control limits are equal positive or negative standard deviation. The aim is to reduce common cause variation and eliminate special cause variation. Control chart is designed to identify trends and pattern, the type of variation, common cause or special cause. The process is statistically within the control limit. So if you can see here, this is an example of the tablet machine, which is showing the target hardness, that our defined hardness of tablet is this one here, like 97. So how much it is varying after preparing the tablets. So we make our lines. We make here that this line upper, this is upper control limit. We should not go up above than this line, and this is the lower control limit. This line we should not go lower than. This is already predefined. Means you will first set and you will make the values that we are going to prepare the tablet, and the hardness should be as per policy this hardness. So we should not go above than this one, and we should not go less than this one. And there is a median line here, average. And if there's any changing and coming in the hardness of the tablet, it's going down, up. But if you see in the graph, the blue line, it is between the common cause variation. Sometimes common cause variation is acceptable, as we said, it's okay. But if the values or hardness is going to the more than the upper control limit, then means like this point, we can see there's a problem in the data. Why it going? There's some problem in the machine. So by this control chart, we can easily analyze our data, that what's going on. The things are between the average or going up and down, or there's some other problem which values are going very up. The other chart is the interrelationship diagram. This tool display all the interrelated relationship and factors involved in a complex problem and describe desired outcome. In addition, it helps a group to analyze the link between different aspects of complex situation. The process of creating such diagram required multi-directional thinking when there is a no straight line cause and effect relationship. Means interrelationship diagram means there is a one problem, but it is affecting from many areas. Like in pharmacy, if there's the dispensing medication late, there can be a problem. Pharmacist verify late. There can be a problem that there's a problem in the system. There can be a problem pharmacy aid absent. So many problems. So we will just make a diagram and interconnect each problem that where is the issue. Like you can see here, excessive over scheduling of the patient, that nurse make over scheduling of the patient. Now, what is the reason? Maybe inadequate training of the new nurse and assistant, maybe high turnover of the nurses, maybe poor handoff from physician, maybe inconsistent use of different lab, maybe here overlap optimistic promise dates for follow-up. So these many problems which are interconnected is known as the interrelationship diagram. This tool is the force field analysis. Force field analysis provide a framework for looking at the factor forces that influence a situation. It look at the force that are either helping movement toward a goal, driving force, or block movement toward a goal, restraining force. This chart is similar to the listing the pros and cons of the action. Forces can be identified through brainstorming if they are not readily apparent. For example, that we want to introduce new technology in the office. Now we want to introduce this technology. Now we are saying that we will ask the staff that what is your decision about this one, or what is your views. Some staff will be against that one and some staff will be for this one. So for example, you can see for this new technology, what is the for management pressure? Management want to bring this technology. Now, robust IT support department, quick upgrade capability, improve efficiency, easily to adopt by the younger staff. This is the advantages. Now, what is the restraint forces? Restraints from the finance and HR department that this new technology is very expensive. Need for additional hardware and space. Expensive upgrade. Time lost in upgrade and training, extensive training required for older employees. So this is the negative points. So what we will do when we have a situation like this, we have to decrease this negative issues, like talking to the finance that is now currently it is very expensive, this system, but in the large scale it will be very helpful for us. We can talk to the older staff that surely it is very difficult for you because you are using the whole technology, but within the time it will be okay. So like this counseling, we will decrease this negative points and we can reach our our goal. Force field analysis is draw as a diagram of two columns, as I show you, driving and restraining forces. Driving forces such as incentive and competition, and restraining forces such as apathy and hostility. However, the force field analysis shows not only the number of opposing forces, but also the significance of each force as indicated by the size of arrow. A key change management strategy using the force field analysis is to reduce the number of restraining forces rather than increasing the driving forces. So as I told you that we have to decrease the restraining forces if we want to implement a thing. Now this is another
Dr. Shahjahan.
Yes.
Just sorry to bother you. You have half an hour left. Just to remind you that.
Yes.
Okay,
tools for
thank you.
displaying teamwork. This is just that when you have make a project, now you want to display that one. So that tool is known as storyboard. It is like when you are giving a poster presentation. So this is known as the storyboard, in which you will just display, present the team activities and efforts, to communicate the team effort with concerned person, to give feedback and recognition, to understand the process of improvement, to learn from the experiences. So in that story, you will put all these things to show that how you start the project, what results you get, what things you learn from this project. So this all known as the storyboard. Now this is the tools for understanding the root cause. When we have any issue in the hospital or pharmacy or any organization, we want to know what was the root cause of that problem. So which tools we are using to find our root cause? We are using the cause and effect diagram, Ishikawa diagram or fishbone diagram, flow chart, Pareto chart, 5-why tree, and stratification chart. This is the 4 tools which we'll use when we want to understand the root cause. Like we have a medication error in the pharmacy. Now we want to know that what was the issue, why this happened, why the expired medication reached the patient. So we will just check all the criteria from the store, problem happened, or problem happened from the sub store, or problem happened from the pharmacist who received, or technician who received the stock, or the pharmacist who dispensed, he did not check the expiry, or the nurse who checked the medication but she didn't check the expiry. So all these things we will review. So we have to use different tools to find out the root cause. First of all, we will discuss the cause and effect diagram, Ishikawa diagram or fishbone diagram. This is very important whenever you do any project to identify the reason or the cause. And also you will receive many questions in the exam. The root cause analysis is a problem solving method which used as an error incident analysis tool. Root cause analysis is a retrospective way of finding root cause. Root cause analysis in avoiding the blame on a single person, instead focus on system error and how to improve the system. The main purpose of RCA is to find underlying problems that increase the occurrence of errors and prevent further harm and prevent adverse event reoccurring through determining the factors involved. In RCA, assessment of the problems and data collection could be done through observation, survey, interview, chart review. A multidisciplinary team should be then analyze the sequence of events leading to the error. One of the most effective method finding root cause is through discussing the problem with concerned staff and ask the feedback. Like I told you before, that if we have problem of the expiry, we will just make a meeting. We will ask them that why this happened. We will go one by all the steps of the process, and then we find where was the problem. Cause and effect diagram shows the potential reason of certain events or problem. Common use of the Ishikawa diagram or quality defect prevention. Causes are usually grouped in major categories to identify sources of variation. Category typically include. So what causes we receive from the staff, we will divide that one. For example, there's a problem in the people, person involved in the process, problem in the methods, any hardware equipment involved in the process, material issue, TPN bag problem, syringes problem, needles problem, measurement issue, data generated from the process that are used to evaluate the quality, environment issue, the condition in which the process operates, example, place, time, humidity. So we have to categorize that issues in that five categories. So this is the diagram of why we are telling this tool fishbone diagram, because it looked like a fishbone. Like in this example, we have the issue healthcare delivery quality. We are not delivering the quality things, so our quality is going to down. So what was the reason? Let's say we have one reason, medical device failure. So this will come under the heading, we will give the heading machine. The other reason is massive inventories. So here it will come under the heading of material. Other problem is coming handwritten prescription, individual knowledge, memory, base forget. So this all the problem will come under the main. Then the other thing is physician shortage, high patient transaction, uncomfortable environment, disaster. It will come under environment. If there is a treatment error, double order entry, outdated information, unnecessary, inappropriate treatment, this will come under method. So from our staff meeting, when we receive all the problems, we will just divide in these headings when we make the fishbone diagram. So this will give you a good idea that this is the last outcome. This happened the error. Why this error is happening? Because of this all the problems. This all the problems are making last this final product. Now the other tool which we are using for the root cause analysis is the flow chart. A flow chart represents an algorithm showing the steps of the process as various kind of boxes data, and these boxes are connected with arrows, flow direction. This diagrammatic representation can give a step-by-step solution to give a problem. Flow chart are used in analyzing, designing, documenting, or managing a process, either a new process or old one in need for design. Like we have a problem. First of all, how you know that this problem coming where? So we want to show that flow of that work. For example, we have problem in the expiry medication. So we want to see what was the flow from where this medication reached from the main store to sub store to pharmacy, then pharmacist involved, then nurse involved. So we have to check this flow chart of that process. Like this one, just example that how we will make that flow chart. We will start with this terminator oval shape, and then parallelogram shape data denotes either the input or output, and then this is a process is represented as a rectangle or denotes any process or action to be carried out, and then this data is valid. A decision is represented as a diamond. So this all the shapes have different means meaning when we have to use diamond, when we are making any decision. So all this each shape have different different means criteria when we have to use this shape. Like this is the example of the flow chart that see here the business unit, there's IT, this is the finance, this is purchasing. That we want to purchase anything, so it will start define the needs, then it will go here prepare paperwork, and then technical review, and then the IT will review that it's approved or no. If it is approved, yes, then it will go to acquire equipment by the finance, then it will go received. See here, this is a diamond shape, mean this is the decision, yes, received. Here this is the decision, yes, approved. So that equipment already now finance approved, purchasing purchase, item received, then issue item, then configure and install, and then receive and use. So this all the boxes is the importance where we have to write which thing. So this is the flow chart which we are using for the root cause. So when we have problem, we can just see, okay, we have problem in the finance. Okay, why it is not approved? We lost the finance. Now the other tool for the root cause analysis is the Pareto chart. This is also important for the exam. They are asking about this one. This tool Pareto chart is also known as 80-20 rule. What is the meaning of 80-20 rule? Which states that 80% of the problem come from the 20% of the cause. Means if we have the medication error in the pharmacy, there is some three kind of problem that is, if we solve 80%, medication error will be reduced. The Pareto chart is a type of chart which consists of both bars and line graph. It displays the values in descending order. I will show you. This is the Pareto chart, so you can understand. So here, what is this Pareto chart? Is a type of chart which consists of both bars and line graph. It displays the values in descending orders as a bar and the cumulative total of the each category as line graph. As you can see here, we have the bars here, and here we will calculate the cumulative frequency of the issue, and then we will diagnose that what are the 3 or 4 major causes which are making the 80% problem. This is the 80% problem, vital few, and this is the other problem. So the left vertical axis is the frequency of occurrence, and the right vertical axis is the cumulative percentage of the total number of occurrences. Because the reasons bars are always decreasing orders, the cumulative function is a concave function. This order helps to identify the vital few, the factors that want the most attention. Vital few is which is the making the 80% problem. From the useful many factors that while useful to known about have a relative smaller effect. So this terminology is also very important, vital few and useful many. Using a Pareto help quality person highlighting the most important among the very largest set. Now we have many issues as you see in this fishbone diagram. Now, which is the main problem which are making the issues? We have to solve that one. If we solve that issue 80%, if we solve that 3 or 4 problem, it will solve the 80% problem. So this is the chart, which is the Pareto chart. You can see types of medication error happen. Now, dose missed 92, wrong time 83, wrong drug 76, order overdose 59. Other also many problems here, wrong IV rate techniques and something. But now we will calculate here with this cumulative frequency, we will calculate vital few. These are the 4 problem. If we solve this 4 problem, it will decrease the 80% medication error. This is known as the Pareto chart, that by this one we will find out what is the main problem, so we can solve that one. So then there's another tool which we are using for the root cause. There's the 5-why tree. It is an iterative question asking techniques used to explore the cause and effect relationship. Like we have, this is just an example, that someone just crossed the car from the red light. Now we will ask the question, why you cross the red light? He will say, late because I become late from the work. Why you late from the work? He will say, I woke up late. Then why you woke up late? He will say, alarm did not work. Then you fourth question, you will ask, why you alarm didn't work? Because exhausted battery. Then the 5 question you will ask, why your exhausted battery? I forget to check it. So the root cause is this one, that he forgot to check his phone, that he did not check his battery is charged or not charged. So this is just an example. So same example you can implement in the pharmacy. If any root problem happen, you will just do more questioning until you reach that where is the actual problem. So this 5-why tree is using to dig out the more the issues. Then the last, this one we are using for stratification chart. It's a chart designed to show where a problem does and does not occur, or to demonstrate underlying patterns. When to use mainly after data collecting to determine which factor affecting the result. This is also a chart which was known as stratification chart. Like for example, we have 3 machines who have making the defects in preparation. So see the machine 1 less defect, machine 2 have more, machine 3 is more. So by this stratification chart, we can easily visualize that this 3rd machine is making more problem. So we have to check more what is the issue. So Alhamdulillah, we finish all. Now, if you have any question, you can ask, or just we can just give you some example of how the exam you will receive the questions.
I think we will let the audience write the answers, so you can just discuss. I will tell you the answers from the audience.
No, I want to just make the visible the bar for me. So let me see how to check that one. Okay. So number 1 is the question that which is the best graph display to show proportion? Pie chart, bar chart, run chart, or Pareto chart? So Saad bin A.
Please, yeah.
And Shumaila D. Okay, Anika.
We will. Can we just wait for 30 seconds for each question, so okay, we will know that?
Yeah. Yes.
Yeah. I think we have a lot of answers now.
Yeah. So the answer is the A, because as we discussed in the earlier presentation that pie chart we are using when we have the data. We want to show the proportion, like surgical data. We want to show that how many portions are from the surgical side, from the OB/GYN, how many from the surgery, how many from the other team. So we have, in this question, we have to answer is the A, pie chart. Okay, now the next question, there's the rate of increase or decrease in total medication error over a 6-month period could be displayed by the use of. So if we want to display over time the medication errors, for which that tool we will use for that one. We will use frequency, line or bar graph, or cumulative frequency curve.
We have different answers.
Okay, so for the second question, the answer is the line graph, because as we discussed before that any data which is over time, the best tool is to use the line graph. The third question is that the senior leaders of hospital are prioritizing performance improvement initiatives for the coming year. Which of the following tools will be most useful for this purpose?
We have answers D and B.
Yeah, so the answer is the A for this one, because as we discussed that if we want to prioritize our performance improvement initiatives, we will take, like we discussed in the Pareto chart, that we will select that one by which if we decrease that one, it will give the impact of 80%. So we will use the Pareto chart for this one. That first of all, we will prioritize which give importance to which issues. Number 4, in developing a performance improvement action plan, which of the following tools should be used first? This is like the exam, same questions are coming in the exam. They are just tricky. You have to understand each word in the question, that what they want to ask.
I think most of the answers are B, cause and effect.
Yeah, you're right, Dr. Sarwat. This is because if we want to develop any performance improvement action plan, first of all, we should know what is the problem. And problem we can get out from the cause and effect diagram, and then we'll go further. Okay, number 5, brainstorming is best used to identify or refine cause and effect relationship, perform intensive analysis, subdivide or organize larger number of ideas, identify, analyze, or plan solution to problems.
I think a mix of C and D for
Yeah, so
question number
the
5.
answer is the D. As we discussed before, that brainstorming we are using when we have many problems and we have to analyze and we have to get maximum ideas from the start. So identify, analyze, or plan solution to problems. This is the brainstorming. Okay, number 6 question. An affinity diagram is best used when information is clearly connected to one issue, rather is inadequate information. The volume of information is very large. Brainstorming is not an option.
We have mixed answers A, C, D.
Yeah, so the answer is this one C. The large volume of information, because as we discussed before, that after the brainstorming, when we have many large data we have, so we want to make them categorize, and categorizing tool is the affinity diagram. The question 7, of the following, which quality improvement tool is probably most appropriate to help determine current process?
We have answers B.
Yes, correct. The answer is the B, because as we discussed that whenever we have any problem happen and we want to know the root cause, first of all, we should check the current process, and current process show by the flow chart. Okay, the next question is when a case manager want to demonstrate length of stay data that depicts both common cause and special cause variation, which of the following should be used?
We have mixed answers B, C, D.
Okay, the answer is the C, Sheward chart. As you told you before that there is many names for the run chart. So we will use the answer is the Sheward chart for that one. Okay, in that one we are in the Sheward chart we are using the uh, data that there is a common cause variation or a special cause variation with the central line. Question number 9. In implementing a care bundle for management of acute myocardial infarction, the recording of the extent to which smoking cessation counseling is provided is a measure of.
Dr. Shahjahan, can you explain this question and
In this question,
answer also?
We
Yeah.
want to ask that in the implementing means we want to implement management acute myocardial infection, the recording of the extent to which smoking session counseling. We want to give the counseling to the patient that for the myocardial infarction that smoking is the more problem for this myocardial infarction. So this type of information which we are giving to the patient, it will come in which indicator?
Process.
As we discussed that we have three type of indicators: process, structure, and outcome. And we are discussing here about the providing the information to the patient.
We have mixed answers. B,
So the
C,
answer
D.
is the B. Answer is the B because we are just providing the information to the patient. So this is the process. We have available a guideline, that is the structure. We are providing that guideline to the patient, that is process. When patient will implement this one and he will not smoking, and the outcome will come that there will be decreased myocardial infarction, that will be the outcome indicator.
The last question, can you just explain the answers because we need to finish the session? I'm sorry.
Number 10. Okay.
Yes.
This is the leaders of multi-hospital system are trying to prioritize the system to introduce in the coming year based on their impact on community. These leaders who work geographically apart can arrive at group consensus without meeting face to face. So now there's many as we discussed before that if we have many hospitals, their staff cannot combine at one place. So which tool they have to use for the decision? So they will use here the Delphi technique. And this we will decide that in Delphi technique they will use the all the combined brainstorming and the multi-voting, and they will send email and then they will receive the consensus.
I think we.
Or we have.
How many questions
stop?
left? Yes, please.
It is, I think there's total 13. Or just send them the slides. They can review their
yes, sure.
And
yes,
they can
sure.
they can discuss with me on the WhatsApp if there's any issue.
Yeah, sure. Yes, sure. Well, everyone, we will be closing the session. And it is always interesting to learn about performance improvement tools. And mashallah, doctor, you have done great job. It looks like you have done a lot of effort in making the slides and explaining and each and everything about each tool, especially to the audience, and especially working on these questions to just make them understand what they learned. So thank you so much. Thank you, everyone. And I have one request from the audience. Please, if we can get a feedback regarding the session, regarding the speaker, regarding the course, so it will be really helpful. Yani, we are teaching the quality, so we want to know what is our performance. So it will be very helpful from you if you will just send us the feedback. Thank you. Allah Hafiz, everyone.
Thank you so much.